Hey guys, thank y'all for joining this evening. What we're going to be talking about today is going to spend a little bit of time with chairside space maintainers. And so, definitely, this is something in pediatrics that, a lot of times we have situations where teeth have to be removed, and it's going to be a while till that permanent tooth comes in. And definitely helping maintain that arch form is important. So, we're going to dive into that this evening here and kind of talk to you about kind of some of the newer advances that we have in that world of spacers. All right. First, we'll go through who am I? Well, first, I'm a dad. These are my four kiddos here, and my wife, Rachel. They just had their first day of school today. We go back early. So, my oldest one, it just started sixth grade. My oldest son started fourth grade. Middle son started second grade. And then our youngest one just started pre-K. So everyone survived and gets invited back tomorrow. So that's a good thing. Yeah. I live out in East Texas. So we live on a ranch out here in the middle of nowhere. And if we're not there, you can find us at Disney. No, when you have four kids, nobody wants you but Disney. And they find out a way to take everything, all your money and all your memories too. So we have a good time going to Disney. I did my dental school at Mother Baylor in Dallas, and this is one of my buddies from dental school. On injection day, you'll see in that carpule, he hit the blood, the vessel, the whole 9 yards. And now I cured everyone from that because he's an orthodontist and doesn't have to give injections. I did my residency at Mother Baylor, so I am inbred, okay, which is now Texas A&M Dental School. And these were my co-residents back in the day. I won't tell you how long I've been out, so it's just been a little bit, but we had a great time there at Mother Baylor. I felt very fortunate to be able to stay. I am a board certified pediatric dentist, and this is Larry Johnson, one of the past presidents of the American Board of Pediatric Dentistry, and also a speaker for New Smile as well. This was us during the COVID times in Mass, so we were both teaching courses at the time, and that was a fun little snapshot in time. I am a board member currently for the Southwestern Society of Pediatric Dentistry. If you're looking for an awesome conference to go to, guys, the ski meeting, it's going to be in Big Sky this year. Or no, it was in Big Sky this time. It's going to be where? It's in Colorado. You'll have to look it up. It's going to be somewhere great, though. It'll be a good time. You should check that out at the end of January, beginning of February. All right. And I am a Harris Fellow for the American Academy of Pediatric Dentistry, and I did my Harris Fellowship with the late, great Dr. Susie Seal, and that will always be a cherished memory and a time for me. I am in private practice. So I'm a private practitioner, guys. As I mentioned, I live in East Texas. I practice in East Texas, and I practice just 1 mile down the road from the Cavity Creator. I'm a giant gun mounted on the back of a big old truck that fires candy into the air. This is a local festival type place, and yep, they don't shoot out M&Ms out of that thing. It's the hard, sticky candies. It's the good stuff. So I'm not fighting, gummy fruit snacks all the time. I'm fighting the real things like candy and Dr. Pepper. And the gummy fruit snacks too. Where would we be in pediatric dentistry if it wasn't for our team? And this is our team that makes everything happen here for us. And so and it helps us with these chairside space maintainers too. So I'm really proud of our group here and really proud of our team that we have. And I love to be able to do education. I love to be able to teach and share my experiences. I always like to say, if I can do this in the middle of a pasture in East Texas, so can you. Okay. So we're here just to help each other to be able to best serve the kiddos in our community. So whether it's a large class, at a large conference, a small hands-on course in an office setting, I'm here to try to help make you the best you can be and help share my experiences with you as well. So our course overview, kind of what we're going to be looking at is what is the universal space maintainer? Like, when would you want to use it? What different types are there out there on the market? And how can we currently go through best using those in the most efficient manner? Okay. So what is a space maintainer? All right. So look at this X-ray here. This is a perfect time to consider using some sort of space maintainer. We've had the early loss of the second primary molar. We have the first permanent molar in, and we still have the first primary molar, and we need to help hold that space, hold that arch form to keep that back permanent molar from shifting forward. So we use a space maintainer. Okay. Why is this important? Well, just like this image is showing, if we don't hold that space, that tooth behind it is going to shift forward. They call that mesial drift, okay? And you're going to get the quote unquote collapsing of the arch, or you're going to get not enough room for the permanent tooth to come in. In this case, we're not going to have enough room for that second premolar to come in all the way. How does that impact the child? It's definitely going to have posterior crowding that's going to occur, and that's really going to make it much more extensive orthodontic needs, more expensive and more difficult for the child. So by being able to maintain that space, we're really going to help create and hold more room, and we're going to be able to help get the teeth in where they need to be. Remember, baby teeth aren't there just for chewing. They're there to help hold the spaces as well. And that's exactly what we're looking at here. So in this spacer, it's kind of the end of its lifetime. All right. It has served its purpose, and here comes the permanent tooth. And so it has held the space perfectly for that tooth. Now that tooth is coming in, it's erupting in, and the spacer can easily just be popped off of there. Okay. And all of these sorts of things can be found in our reference manual, in the reference manual of pediatric dentistry. And we've got the page number there. So you can reference the indications for those and everything within what I like to call the pediatric dental Bible. Okay. The dental manual. All right. So, in a nutshell, what we're doing is we're trying to utilize this guy to hold that space so that that permanent tooth has room to grow in. Okay. So why might we see the early failure of that primary tooth? Obviously, cavities are a big issue. As I mentioned, where I am, we are in a pretty high cavity rate area. So unfortunately, we get lots of new patients that are coming in with pain, and it's these molars in the back that are causing those pain, and they're causing infection. All right. We can have trauma to the area. I have lots of gnarly traumas where kids fall and hit their chins, or are biting on something within their mouth when they fell and they chip a tooth, break a tooth, something like that, where the tooth has to be removed early or gets broken. A lot of times, ectopic eruptions sometimes can cause these primary molars to need to be extracted because the permanent molars coming too far mesial. And so we can extract that tooth and work on maintaining as much space as we can with a space maintainer. If a space maintainer is not there, once again, we could see a lot of issues in that area where that back molar is going to be shifting around. It can have rotation. It can affect their crossbite, the overbite, the overjet, and a lot of unfavorable molar relationship issues in there if we're not able to maintain that. Particularly if we're serving a state-funded insurance or, a Medicaid population in your area. In the state of Texas, orthodontics is not covered by Medicaid for the most part, but space maintainers are. So we can really utilize these to really help that child maybe avoid those more expensive, more in-depth orthodontic procedures they might need. And that would really reduce the out-of-pocket cost of that child and really increase the access to care they could have and a chance to have a much better arch form. Okay. So there's many different types of space maintainers when we're thinking about it. Let's start with kind of the unilateral versus the bilateral. Okay. The unilateral is what we're going to focus on tonight, but I also want to point out that there are bilateral space maintainers too. And the bilateral crosses across the arch. So on the upper or the lower ones. And a lot of times that is held onto the permanent 6-year molar in the back, and will come forward to have a rest either on the palate on the top or behind the lower anterior incisors. Okay. The unilateral one is just for one single tooth space. If you've got more than one tooth space, we're not using the band and loop or the unilateral one. We're going to use a bilateral one if possible. Okay. So in our unilateral types of things, we've got two types of those. Traditionally, we had the lab fabricated ones, and we'll go through that in just a minute. But we also will have chairside ones where you can actually make it and deliver it same day, okay? Literally in just a minute or two in the chair. Right there is the patient sitting there. So we'll walk through what that looks like. These universal or unilateral chairside space maintainers are not anything new to the market. These have been on the market for a long time. And we'll kind of go through what the different types of those look like as well. Okay. So let's kind of dive in first to a lab fabricated one. Okay. So as we're doing this, you're going to extract the tooth and we need to make a mold of the mouth. You can do that with either a 3D printed scanner, and New Smiles actually has a partnership with a scanner company. And so they've got quite an awesome scanner. So if you're looking for a scanner, you should talk to the reps about that because they've got a pretty handy one as well. I don't do a lot of impressions in my practice. So if I'm going to make an impression, I'm not 3D scanning you. I'm just using the good old mix it up, alginate and slap it in there in the impression mold. Okay. Then we have to pour it up. If your team is like my team, they absolutely hate to take impressions and they hate to pour it up. Okay. One of my staff calls it stoning the model. And I'm like, nobody says that. If your team says that, I want to hear about it because I think she's the only person in America I've ever heard say to stone a model. It's a funny little thing in our office. Nobody wants to do it. Okay. Then we have to mail that off to the lab to have them custom fabricated. Okay. And that's definitely going to take a week, 2 weeks or so to be able to get the turnaround on that. And so definitely that patient is going to have to return for a second visit to have that delivered. Okay. Some of the pros of that would be it is a custom fit. And so you're making that mold and you're custom fitting it for them. And so theoretically, it should be a really nice fit there. And a lot of times with those, they put a really strong weld on the side of those too. So the chances of there being issues where the band and loop come together are very, very slim. Okay. Some of the cons that we tend to see with that is the cost. They're definitely going to be more expensive than our chairside space maintainers, okay? And you also have to think about the fact that you're having to pay postage, okay? So that is your physical cost. There's other costs to you like chair time. So if you're having to have a second appointment, those of us in private practice can appreciate that chair time is money, okay? And so if we're having to bring that patient back to have it cemented, then we definitely are having an additional cost accrued by the practice in chair time. Not to mention the cost to the parent by having to take off work, drive down to the office. Gas prices are so high these days. Parents are already complaining about that where I live because we live in a rural area. So you definitely have to drive to come see us. And so that is a strong con is an additional appointment depending on your patient population and working parents or parents that are having to commute to your office. Okay. Patient cooperation is always a solid concern in a second appointment. Okay. Sometimes that is a positive where it might be nice to, after the extraction's done, then we can come back for a second appointment to do it. But if you're having to make a mold of it and you made the mold after the extraction, that's definitely going to be a cooperation concern for sure. Can the child cooperate for an impression post-extraction, or did you need to take the impression pre-extraction? You're definitely going to get a better impression post-extraction, but the cooperation might not be as good. Okay, so all things to consider when we're looking at a lab fabricated one versus a chairside one. In a chairside one, what we're looking at is a very similar process where you extract the tooth. And in this case, you're going to fit the band. All right. And this band is already going to have a pre-soldered little loop that's going to be on there, two little tubes. And then you're going to fit the loop into that little wire into those tubes. Then you crimp that little area to hold them together, to hold the loop inside the tube. And then we're going to cement that on and verify a good fit. This literally only takes a minute or two to be able to fabricate these chairside and deliver them. So definitely that is something where an instant improvement as far as timing goes and ease of placement and everything. So definitely a huge pro in comparison to the old school traditional impression send off for a lab fabricated one. The ease of placement of that, the less chair time and no second appointment are solid wins, wins, wins. For me in a practice, as I'm looking at integrating new equipment, new technology, new procedures, it has to be first a win for the patient. It has to be second, a win for the office. And third, it has to be a win for those doing it. So for my team and myself, if it's not easy for us to do, then definitely that's going to be a struggle for us to implement it. If it is not a win for the office office as a whole, where it's costing us more money than it needs to, or the flow and the scheduling is not good, then that's definitely going to be a barrier. And definitely if it doesn't benefit the patient, it's not even going to make it out of the gates. Okay. And this one is a 3-prong win for me. It's a win for the patient, a win for the team, and a win for the office as a whole. Okay. Some potential cons here is that you do need to make sure you're adapting it to fit the top of the tooth around that occlusal table. And we'll talk through that, where your custom made one from a lab would already be pre-adapted for you. That only takes a few seconds to do. And making sure that we're having a good, strong weld where the band and the tubing is attached. The new Smile Universal Space Maintainer uses a strong laser weld to be able to attach that together. And so it has a very nice, strong bond. And we'll walk through that too in a second. Okay. Let's talk a little bit more about some of the pros and cons between this new Smile system with their universal space maintainer and the more traditional competitor, okay? One of the biggest difference here, guys, is that the band fits both top and bottom, meaning that it doesn't have pre-built in things like it's too narrow, too wide, this to fit an upper tooth or a bottom tooth like the other competitors are. It is one size ring in the numbers. So it goes from 23 to 42, and those are universal. That 40 can fit the top and the 40 can fit the bottom. Unlike the competitor, they've got a 40 for the top and they've got a 40 for the bottom. So by having a universal size of a ring, you've already reduced your inventory and what you have to order by half, okay? In the leading competitors, they have a wide size loop and a narrow size loop, depending on the band. Some of the bands have wider attachments and some have narrower tube attachments. Once again, we only have one of those wire sizes in the new Smile. So definitely that's once again going to reduce your ordering and what you have yet again by half. Okay. So the stocking that you need to do with the new Smile, the ordering that you need to do for the new Smile, it all comes in one cassette, not two. And you only have one band size and one loop size, not two band sizes for upper and lower, wide and narrow. That's 4 things. And then stocking a wide and narrow loop. That is a lot for the assistant to hand you in an appointment. I always found myself, I need the loop. I need the narrow loop. Well, they're handing me the wide loop. Oh no, I needed the narrow loop. Let me get the narrow loop. And so it's definitely a lot of an easier system for the team as a whole. Okay. And so once again, for this system, it makes it an easier process for the team as a whole and us working together during the appointment. And it makes it easier for the office because we're having to order and stock less things. Okay. So to me, that is a win-win. No difference to the patient, but a win-win from the office side of things. Okay. Less stuff, less fuss. That's what I'm about. Okay. I'm just looking at the rings. So this is the bands of the leading competitor and the new Smile. One of the first things you're going to notice is how much shorter the tube is, the tube length on the new Smile one compared to the competitor. I don't know about y'all, but when I was using these competitor ones, I always found myself having to cut that dadgum tube length. That tube is way too long. And you're going to get in one where it's like a small little first molar that you extracted, and you're trying to fit that into the space with the loop. And it just became very cumbersome. I'm having to cut it with a 330 burr. This is not helping my chair time efficiency. Brilliant that New Smile just made it shorter. That shorter tube size, I can tell you, I have not trimmed one of those tubes since I made the switch over, and I've been using these for over a year now, and I have not cut a single tube. For me, as a team member in this, that is a huge win as far as chair time efficiency goes, okay? The other thing we're going to notice with this, once again, is that the shape of this is more universal, okay? So you can actually put into it the occlusal crimps that you want. It's a very malleable, moldable stainless steel metal, strong but moldable. You'll also notice the nice, strong laser weld. So it's not like a weak little pinpoint of a weld there. It is a strong weld. So definitely this shorter tube size is less fuss and more efficient. I love that as part of the design here. One of the other differences, as we mentioned, was in the actual wire loop itself. Okay. In the leading competitors, they had a wide and a narrow, which is so annoying. In the new Smile version, there is one width, less ordering, less things to talk to the staff about, less things to communicate, less things to be lost in communication. Okay. So when you're looking at ordering loops, your loop wire, all you're going to order is a plain, a curved, or a distal shoe attachment. Those are the three options. It's simple. You don't have to worry about a wide and a narrow plain wire, a curved wide and narrow, a wide and narrow distal shoe. Like none of those things are a problem here. None of those things are things that you have to train new staff members on. That is just a reduction in inventory and a reduction in overhead, and it's brilliant. The other thing that we're noticing as well is that a lot of people love these curve loops, and we'll kind of talk about how you can use those in different ways. But this curve loop is not quite as big of a curve. So when you're trying to nestle it up to a canine, you don't have to worry about it flying over the top of the canine. It can go down below the bulge of the canine easier here. So it has a better optimal curvature to the height of that curved loop. And that sometimes can really make a difference. And we'll show you that. By far, one of the most brilliant things I think that was done at New Smiles with these is putting laser markings on them. Okay. They literally put 1 millimeter markings on these loops to help you trim with more precision, to make it easier to trim these. You can literally pick it up with cotton pliers, put it into the extraction site, and be like, oh, I need to cut 4 of these little hash marks off of there. Cut, done. Boom. Mind blowing. That is such an improvement in efficiency and just shows you how in tune New Smiles is with trying to meet the needs of their clinicians and the team. Okay. That right there made the team component of that 3-prong system such a big win for this piece of equipment because it really helps us trim more efficiently. And the quicker we can trim, the quicker we can get this in and the less chair time. Okay. With all these bells and whistles, I know you're afraid it's going to cost you more to switch or to use these. And no, these are actually less expensive than the other leading competitors on the market. And New Smiles even has a back to school special that they're running right now on both their stainless steel crowns and their universal space maintainer kits. Trust me, you're just going to get the professional kit. You're going to want the one that has all the stuff in it, and they've got it on a super 40% discount right now. They'll circle back to that at the end. That's a stellar discount, guys. Okay, so if you're looking at that to make a switch, now's obviously a good time with that. Okay, let's walk through this step by step by step. Okay, what we're looking at here is we've got a tooth that we had basically an abscess. We were putting it on amoxicillin, dried it up, and now the tooth needs to get out of there. We had some failure to that first primary molar. This is your classic example of a space maintainer. It is going to be a long time. This kid's not even 6 yet. That tooth isn't going to come in till 10 or 11. So we definitely need to hold this space for a while to be able to preserve the space for that permanent tooth. So we have our traditional things handy for our extraction. Okay. So all of our normal stuff, and we get the tooth out of there. Then we're going to fit our band. What I want you to notice is that on this primary molar, there's a large buccal curve to this tooth in particular. So when you fit the band, you're going to put the band all the way down over the buccal bulge of the tooth, okay? We want it to fit down all the way. If it's too narrow, it's not going to seat all the way and it's going to try to come off. Well, now we have all this spacing at the top of the band, at that occlusal table. Well, we can easily crimp it. When I'm sizing these bands, I don't want it to rotate and spin. I want it to slide down and lock into place, slide down and lock into place. And that's exactly what this spacer does, this band does. What I also want you to notice is the tube length, okay? If that tube length was longer, it would make it a lot harder to put that loop wire into those tubes. And thus, we are going to have to trim a lot on the wire and trim a lot on the tube to be able to get them to fit together. Well, that is very annoying and takes a lot of time. And so with this new smile design, with that shorter tube length, you can really see here in the picture how that is benefiting us because it really helps to make sure we've got plenty of room in there, okay? Now we're going to fit the wire. The picture on the left is what it looks like with an untrimmed wire. So I put it in the tube and you'll see how it goes over the top of that canine. It's too long. So then I trimmed it with just regular wire cutters, okay? Nothing special about these. A tip on that, okay? When you're cutting these, I always try to make sure I either cut it in the trash can or cut it under the table so that the piece of the wire doesn't fly out, okay? You don't want it to go in your eye or the assistant's eye. You don't want it to fly somewhere funny, okay? And also, I would cut it with the back of the wire cutters, not the tip of the wire cutter. You get more use out of your wire cutters if you cut them at the back and not the tip all the time. Just a little pro tip someone gave me once, and it really helped me extend the life of my wire cutters, okay? So you'll notice here how nice that fits there, okay? What we're looking at is the back of that loop is pressed up firmly up against that canine. We're trying not to dive it down towards the gingiva, and we're not trying to point it up towards the sky. If it points up to the sky, it's going to more easily come off of there. If it points down to the gums, it's going to irritate the gums more. So we want it to be nice and level if we can, okay? The next thing we do is we're going to grab some crimpers and we're going to crimp the tube. You see how I'm grabbing it right there where the tube and the loop come together? We're going to crimp that area. Honestly, it doesn't really matter what you're using. This is a specialized tube tool that crimps it, and you can order these from New Smiles when you order the kit. They come with these little crimpers. New Smiles actually has an armamentarium of these instruments that you can order directly from them that are specifically made for this. So if you don't already have these or some of these in your office, then you can also order all the tools, like the setup that you need to do this comes straight from New Smiles too. So they can get you that. They got everything you need. And so you're seeing me crimp this. And I am specifically using here the tube crimper. So it's like a little flat bird beak that has a little hole on each side there so that it perfectly holds and gives you a good crimp. If I don't have one of these handy, I will use just a regular crown crimper to squeeze it tight, or I'll use a howell plier to squeeze it tight. Once you squeeze those, I always pull on it to make sure it's not going to come out. If it comes out, that's not good. Put it back in there and squeeze harder, okay? We want to make sure that we are holding that in there and it's not falling out. What you'll also notice in this picture on the left is you see how I've crimped the top of that. Okay, so I've pre-crimped the occlusal table on my band, and I will just use regular crimpers for that, just to crimp over the top. That's how I like to do it, okay? Then we're gonna cement it, okay? You can use any sort of light curable cement that you like. I would definitely go with a light cure cement over a self cure because you want it to be set and firm before you walk away from this, okay? You don't want it to be easily able to pop off of there. New Smile has launched this year New Sim. If you haven't used it yet, you definitely need to give it a try. It is ideal in situations like this. It can replace your Fuji Sim and it can replace your Reliax. And it is a dual cure. So it's a resin modified glass ionomer eluting cement. And so you put the cement around the band, put the band on, wipe the excess off, verify the seat, and just light cure it, okay? And that's exactly what we did here. So you'll notice that the occlusal table now has a nicely adapted band to it. Well, previously before it had a lot of spaces. So you could see how there'd be a lot of excess room for cement to hold that. That's not ideal, okay? What I did was I crimped this band to lean it over, okay? And that's what you're seeing here. Now, let's say you sometimes when you crimp it, you still have little areas that lean up more. You can take a bite stick and you can push on it and push it over, okay? Or you can take a crown pusher. They have specific little ones that have that little square end on it that you can push and bend that band over more. So you definitely want to make sure you're adapting it before you're cementing it so that you get a nice adaptation. And once again, these bands are very malleable. They're strong but malleable. Okay. The other things that we're noticing here is we want to verify the seat of this before we let the patient up and away. So I'd want to make sure I'm checking it again to make sure it's not coming off. We're verifying the fit. You'll notice how this one isn't pointing up. It's not pointing down towards the gums. It's nice and level. This is a plain loop. And a lot of times I do love a good plain loop. There's great times to use the curved one, and we'll talk a little bit more about that. And there's good times to use the plain one. And in this case, we used a plain loop. Okay. The other thing I want us to think about when we're talking about a chairside space maintainer is these can be placed when you're in the operating room. Okay, you could place these in the OR. You could place these in office sedations like when you're doing IV sedations, oral sedations, nitrous, stuff like that, where you've already got the patient in a great position. And let's say cooperation is a concern. Well, you don't have to worry about that with a unilateral space maintainer because you can easily make that chairside while they're during their sedation phase. Okay. One of the things I would always mention is you do want to have a nice throat screen, throat pack, some sort of isolation in there as you're putting these in and out. I wouldn't just put these in and out with some sort of screen, just like you don't take you don't extract a tooth with some sort of throat pack screen, something in place for isolation. You definitely want to try these in and out and cement them with isolation in place. Okay. So I just want us to be thinking about that from a safety and aspiration risk, just like we do with anything else in dentistry. Okay. We do want to make sure we're respecting that. I want to talk a little bit more about this cement right now. Okay. Since this is a newer cement to the market, I just wanted to share with you kind of some of the comparisons. I myself, for a long time, have been a Reliax fan. I really like Reliax. I've used Reliax for a long time. And definitely we can see here how the strength of this new sim on the left side on both these graphs compares to other cements that we see on the market, and we can see how we're having a better strength in those categories. We can also see water solubility. We don't want a lot of water solubility, and so we'll see how the resin cement, or that, excuse me, the new sim is going to have a superior reliability as it relates to the water solubility, particularly in comparison to Nexus, Fujisim, and the Relax one here as well. I thought this was an interesting one, so I threw this in there. We really don't care about color stability on like your stainless steel crowns, anything like that. But when you're cementing on a space maintainer, if we're not having a good color to that and it's looking funky, a lot of times the parents are going to be making a comment on that. And so I do see that a lot with my Reliax cement where it looks kind of like dingy after a while. And I really never thought about it until I looked at this study and I looked at their like comparison to this. And I just thought it was kind of interesting to see the staining of the Reliax versus kind of what the other ones look like. I just had become used to the Reliax one there. So I thought that was like kind of interesting, and just you wouldn't care really much about color stability. But realistically, around the band, it does make it look better. Okay. I did want to spend a little bit of time talking about distal shoes. Okay. So we do have indications for distal shoes. Okay. And this is a great image of a typodont. Okay. I took this picture today because I just thought it was a really good one I wanted to share with y'all. One critique on this band, okay, do you see how the band isn't down all the way over the buccal bulge? you'd want to go up one band size. So I'm going to critique myself because I did this today and I should push it down a little farther. But when I took that picture, I thought, ooh, that's a good lesson. So I'm going to show them that. These typodont teeth kind of suck. They're not as good as the permanent ones. And so they're kind of like janky to fit things on. But it turned out really good everywhere else. So I was like, this is a good teaching technique. You want that to go down farther. Okay. So it sits just ever so slightly at that occlusal table. You don't want that. But what I want you to pay close attention to is where the placement of this distal shoe is. So this is excellent, okay? So a distal shoe would be a situation where you've extracted like the second primary molar, and in this case, we've extracted K. And we're putting the loop, or we're putting the band on tooth number L, okay? And so we don't have the eruption of the permanent sixth-year molar just yet, that permanent first molar. And so we're trying to hold the space. But the regular loop wouldn't do it because the tooth is actually subgingival. So you're going to use this, what's called a distal shoe attachment, to reach down below, yes, below the gum. You put it into the socket and you push it back up against that permanent molar. And you are going to seat it there where part of it goes below the gums and the loop stays up. Anytime we do a distal shoe, I will normally always take a pre-cementation x-ray to make sure that I'm happy where the position of that shoe is before I cement. Then I will cement the distal shoe and take another post-op x-ray to verify the fit and the position of that. I do not want it to be over the top of the occlusal table of that permanent molar. And I also don't want it to be a couple millimeters in front of it. I want it to be resting right there next to it. If it's too far forward, and it's, let's say you pushed it back and you thought you got it back all the way, but actually you pushed it up against a bony spicule or a piece of trabecular bone or something down there. No, you want to verify that before you cement it. If you cement it, then you're just going to have to pop the thing off, clean it all up, and go again. It's just messier and you wasted cement. So I always like to do a pre-cementation x-ray when cooperation allows, okay? Let's say, what if it's too tall and this distal shoe sits up too high? Do you see how this one's angled backwards more? That's helpful. It's angled backwards and down because you do want this to sit down at the gum line. You don't want it to sit up too tall and then things to be chewing on it and pushing it down in the gums. If it bounces up and down, it's really going to feel like something's stabbing them in the gums when they eat. Because guess what? Something's stabbing them in the gums as they eat. That's not great. You wouldn't like it. They're not going to like it. So if it's too tall, sometimes you need to trim the edge, the bottom part of that. So this is the top. That's the bottom that goes down the gums. You want to trim the bottom of that to help. Okay. So these are all things that we want to be conscious of with distal shoes. Once that permanent molar starts to grow in more, then we can have the patient come in and we can actually cut off that distal shoe and leave the loop in place and just re-cement back on the band and loop again. So we just cut off the distal shoe portion and we just continue to use it, okay? Let's say, what if we've got a patient where that first molar is coming in, but it's not in all the way. It's still down at the gum lines. In that point, do you need a distal shoe or do you need a band and loop space maintainer? I would do a band and loop space maintainer and make sure we're pushing it all the way up to that erupted portion of the tooth, and I would angle it down more at the gum, okay? If we can avoid putting this down into the gums with the distal shoe, every patient's going to be happier, okay? And so in that case, you can do what we call a reverse band and loop, and that's exactly what the distal shoe is. It's a reverse band and loop, but it's one that has the extension downward. So if we're taking out the second primary molar, like we do in this case, and we've got the first permanent molar growing in, but not in all the way, we can do a reverse banded loop. So the traditional one just flipped around. And guess what? That's why you have the smaller band sizes. It's for these reverse banded loops. And honestly, I do a pretty good number of those. I just tend to find that these 5 to 6 year olds are losing these second molars quite frequently in my practice, and that first molar's just not in enough. Okay. Now let's talk about variations between the plain band or the plain loop and the curved loop. Okay. Some people just adore these curved loops. They love them. They like the way it pushes down at the gum line. Okay. Do you see how that middle one in this middle picture, it's resting downward? Okay. It kind of curves down at the gums. That can be super helpful. But do you also see how in certain situations it might look like it comes up and down and it might jab them in the gums more? Well, sometimes it's nice to flip the curve over, okay? Sometimes it can go either way. It can curve down below the bulge of a canine, sometimes good. And sometimes it can curve and slip up and under into the contact point of a primary molar, like it's doing down in the lower right-hand side. So you can get a little fancy with these and kind of bend them different ways or flip them different ways, or you see how great just the plain loop looks here? That plain loop fits quite nicely. And so a lot of times I like a plain loop and then I can bend it. Guess what? You can take 3-prong pliers and you can bend it up. You can bend it down. You can bend it to the left. You can bend it to the right. You can manipulate these in different ways to help them custom fit better. And it just takes a little bit of time. Okay. And so these are all prime examples of kind of how you can manipulate and adjust your banding loops to kind of fit different ways, depending on how the curvature of the anatomy of the teeth are, how the curvature of the anatomy of the gums and the jaw is. And so definitely those are all things to take into account. And it's nice to kind of have some of those options. And that's one thing I would mention is that you do have the options between those, but not so many options that this cassette is overwhelming with the wide, the narrow, the upper, the lower. There's none of that. It's a very simplistic choice option. And there's definitely ones that are easier depending on what that mouse situation looks like. So I really wanted to make sure that we could kind of share those and appreciate what that looks like in these situations. Okay. So to kind of recap for us, space maintainers can be an excellent benefit to your patient population, particularly if you have a situation where you've got the early loss of a primary molar. Maybe you don't see that as much as I do in my practice, unfortunately, but definitely no matter the frequency of that, it's still important to that patient who finds themselves in that need. And what a need you're rising to the occasion to meet for them by providing them with a spacer, okay? By helping to maintain that area, you're just really helping that patient have a much more successful growth development of their mouth, okay? As I mentioned, it needs to be a win-win-win. If we're going to be implementing something in a private practice setting, it has to be a win for the patient. It has to be a win for the team, and it has to be a win for the office as a whole. And truly, this universal space maintainer meets all 3 of those wins there. It's quick, it's easy, it's cheaper, it's more simplistic, it's less fuss. If it's less fuss, it's faster, it's easier. I am all about it. Okay. And so definitely those are things that we want to be considering as we're implementing things into our practice. And as I mentioned for y'all as well, I am in the middle of East Texas. I'm in a pasture in the middle of East Texas. If I can do this in the middle of nowhere, you can do this wherever you find yourself. If you're in a Crystal Palace somewhere, then you're going to deliver the best dadgum space maintainer you can, I'm sure, just like we do out here in the middle of nowhere. Just like this picture, the space maintainer has met its end. So do we meet our end during this presentation. I hope you have learned some things. I hope you've taken some things away, some tricks, some tips, some uses, some things like that. This is my contact information with my email. If you've got further questions for me after this, my social media as well. Honestly, messaging me through social media is probably the easiest way to get a hold of me too. I run all of my own office accounts there. And so I'll open it up now for Q&A.
Thank you so much, Dr. Curtis. That was
Yeah.
such great information as always. We do already have a question, so let me read that out to you right now.
Yes.
Um, Diana asked, what type of burr do you use to cut off the distal shoe?
Great question. You can pretty much use whatever you want to use. Okay. But what do I like to use? I love a 330 burr. Okay. That fluted 330 burr will cut through that pretty quickly without burning up your really expensive diamond burrs. Okay. You could do like a 245 if you got that bigger bite to it, but I wouldn't use like a polishing burr. I wouldn't use a really fine diamond burr, something with a little more bite to it. And I would do it with a little bit of water and high speed suction right there. The reason you'd like the water is because you are going to heat it up. And if you're holding it in your hand and you're cutting dry, it's definitely going to get pretty hot in your fingers. Okay. Just trust me from experience. Okay. And then you want the suction there because you want to cut the, catch the pieces of debris, but also all that water that you're spraying too. Okay. So just a little bits of pro tips there. And I would definitely do it away from the head of the patient, kind of beside the patient or behind the head. If you've got like the tabletop behind the head of the patient, that's a great place to do it on like a napkin or something there. But those are honestly pretty easy to cut them off and to size them down. As I mentioned, sometimes you need to make it a little shorter. You can just slice it over that. And then honestly, you can just take and round it off. Okay. I do the same thing when I have to trim the tube. I use a 330 to trim the tube, and then I put the 330 inside the tube to round it out a little bit. Okay. Great question.
All right, we got another one from Lucelli. She says, do you numb prior to removing the distal shoe?
Oh, it would be so kind, you Sally, to remove to dump them before you remove that distal shoe. I would probably just do compounded topical. Okay, I would not just use that cheapo Prilocaine topical. It's not very good. Okay, but I have a tack compounded topical made and my pharmacy down the street will make it for us. So I'm sure if my pharmacy here in the middle of nowhere can make a compounded topical, yours can too. Okay. All you just call them up and say, I need a tack compounded topical, and they'll make you a big old tub of it for pretty cheap. And just a little bit of that, dry the gums off and put that over the gums, and that will truly numb those gums up hardcore. Okay. And it does penetrate quite deeply into that tissue there. If it went really, really deep and you felt like you needed to put a couple of drops of lidocaine into that area, then don't feel bad about that either. They shouldn't really even feel it after you put that compounded topical on there. And then that would make taking off that spacer in that situation so much easier. Same type of thing if that loop kind of bears down into the gums a little bit. I normally just leave those and tell them, well, it's better there than pointing upward. And as long as it's not hurting them or bothering things too much, then we're okay to leave it kind of pointing down. Keep it clean. But when you go to remove that, if the loop's pointed down a little bit, you definitely probably want to put a little bit of that compounded topical over the gums before you pop that sucker off of there. Sometimes they come out really easy from the gums, but sometimes those gums are kind of irritable around that area. And it's definitely going to be a little nicer to have that taken out with a little bit of numbness there. Great question, you Sally. Other questions for me, guys?
Go ahead and put your questions in the Q&A box if you have any. While we wait for more questions, I also wanted to remind everybody and speak a little bit about our buyback program because I think if you're worried about making the jump because you're holding a lot of stock on of the current space maintainer that you're using, we do buy them back at New Smile. So if you're interested in that, you can go ahead and give us a call. We will buy up to 50 space maintainers back. So don't worry about your stock if you're holding on to a bunch of them.
And that honestly is a really good deal on these space maintainers now.
Mhm.
I see some friends in there. Thanks everybody for tuning in tonight. I know everyone's really busy. And like I said, if we've got more questions coming in, you just let us, you can send those to me. I think we've got another one going here coming in. Thank you. from Diana. Sometimes gingiva grows over the space maintainer loop. How do you manage that at the time of removal? So that's what I was kind of speaking at, Diana, that I would put some compounded topical over that, or just do a small injection into that area where the gums are. Then just take your band remover, pop it off of there, and then that will make it come out so much more comfortably. Okay. Now, let's say it's just a crazy little kiddo and they're not going to let you do anything and you just got to reach in there and pop that sucker out. Always have gauze, okay? Because you don't want him to eat it, okay? Normally, with those band removers, you can easily grab it and it goes in the band remover and you take it out together. But if they're a squirrely little one, you always want to have that gauze there on the inside and put that on the inside of it. So if for some reason it goes towards the middle, it'll get caught in the gauze and you can pull it out together, okay? So if we've got a squirrely little friend there that we're having to work with, where we're concerned about kind of how we're going to get this numbed and we just need to kind of get the band-aid off of there, that can still work in those settings. But you just want to be conscious of the, getting it out and not swallowed. Okay. Yeah. But a little compounded topical goes a long way. Any other questions for me, guys? Those are all good ones. Oh, you're welcome. So welcome. Oh, we got another one coming in. Do you have any tips to retain the space maintainers on little ones that like to remove them? Oh man, if we could write a book on compliance, couldn't we? Liz, that's a solid question. What I always tell my parents at time of delivery, okay, I've learned this over time. I tell them a couple things. I say absolutely no sticky candies. And that means Starburst, Laffy Taffy, gummy bears, caramel, stuff like that. Anything like that, we want to avoid it. I also tell them you're not going to make it through a sleeve of those Starbursts without that thing coming out of there. Okay. They eat one or two Starbursts, they're going to get brave because it didn't come out on the second one. But by the sixth one, that thing is going to be stuck in that Starburst. Okay. I also tell them don't call me on the weekend about it. Okay. It's not an emergency. It always happens Friday at a birthday party or when you're trapped on a cruise ship. They'll be fine. You just put it in your purse and call us the next Monday, and then we'll get you in and we'll easily clean it up and pop it right back in there. That has reduced so much of your calls you'll get just by telling them right there at delivery, it's okay. I also tell them don't get mad at Johnny if it comes off of there. He needs to know that it's okay to let you know. You don't want Johnny to throw it away because you're going to have to make a new one. You want Johnny to tell mom so that mom can put it in her purse. I had one kiddo that got it lost at an Easter egg hunt eating the candy and he put it back in the Easter egg and threw it back out there for somebody else to find. Isn't that hilarious? And so you don't want that to happen. So having that important conversation at the beginning is very important for the ones that like to pick at it. That's your second one. It's either candy or a picker. What I always tell them is you get 2 tries. All right, we're going to re-cement this twice. And that's not my number. That's going to be the parents' number. They get so annoyed having to bring this kid back down there to have that cemented in more than 2 times. They'll normally do it twice and then the parents over it, the child's over it, and you're definitely over it too. You have to remember these are elective things that we're doing. They don't have to do it. The child does not have to cooperate for it. But we want to make sure if we've got a good fit and we're using good products, that's going to help it be able to sit in there as best it can. And we want to make sure we're having those discussions if the kid's a repeat offender, identifying, well, what was it, do you think that made it come off of there? That's a really important question to have answered there because that's going to help us make sure we can get to the bottom of it. Okay, great question. Oh, we got another one coming in. Does the permanent tooth need to be visible in the mouth through the gingiva before removing the space maintainer? Or if it's through the bone radiographically and the patient's complaining about it bothering them? Ooh, Really good question. Okay. We'll look at this. Obviously, this picture we've got at the end is the end of the life of this space maintainer. Okay. But it doesn't necessarily have to be popping through. Okay. Let's say, what if this was 6 months before and I'm seeing that this permanent tooth is well positioned and there's plenty of room. Okay. I could easily remove it at that space maintainer. My rule of thumb is if there's two teeth behind the space in occlusion to each other, you can remove the space maintainer. And you can see in this picture here, you've got two teeth that are erupted in occlusion posterior to the space. So we could have easily removed this space maintainer prior to the eruption of the tooth if we wanted to. Sometimes it's nice to leave it in there. So to answer your question, Emma, sometimes I do remove the spacer at their recall appointment if it looks like between now and the next 6 months it's going to pop through on the x-ray. I'm just going to go ahead and remove it. It has served its purpose. Or let's say they are a 7-year-old and we have the band on that second primary molar, and now the 6-year molar has erupted, but we know it's still going to be quite a bit of time before the premolar comes in. And that child is ready to eat some Starbursts and ready to get that thing out of there, then you're fine to remove it. It's served its time because we've got two teeth in occlusion posterior to the space. You're going to get way less of the shifting there. Okay. Great question, Emma. Really, really good one at the time of the end. Okay. Dr. Duffy, hey girl, it's good to hear from you. All right, she's coming in with the question of, does New Smile sell band pushers, not the bite stick, but you get the one where you can push from the occlusal? I am pretty darn sure that they do have a band pusher in their kit. Okay. They've got a really good set of stainless steel wire clippers. They've got the tubes, like little crimper thing to crimp the tube, and the band pusher as well. We definitely have solid friends of the band pusher, not the bite stick, but that band pusher. I know exactly what you're talking about. And they should have that on their website to order through their supplies. Yes, ma'am.
That is
Great.
true.
Oh,
Yes. And
good.
those are new. Those,
They are.
yeah, we just came out with those on in May. Yeah, right. We launched them right at
Yeah.
AAPD. So they're very, very nice tools.
One of the things I will also mention with these that, as Dr. Duffy was talking about pushing with that, with not the bite stick, but the band pusher, it's really important to make sure, excuse me, that we're adapting the top of that occlusal table. That's really going to help with the fit of it. It's really going to help decrease the excess space that the cement has to fit in there, and it's really going to help it from shifting around up or down. One of the things you'll notice is if we're having movement to that, most of the time it's because the band's not fitting as good as you wanted it to. So actually adapting that and everything is nice. Other thing I'd mention too, looking at this stainless steel one, is if you're going to be doing a stainless steel crown and the spacer, have your assistant size the band outside of the mouth on that stainless steel crown. That way you're not having to do it once it's in the mouth. Boom. Such a novel idea. Okay. I know that sounds crazy, but if you haven't thought about that, it is like game changing to you. Okay. So literally your assistants can fit these in your like FMDR cases where you're doing all these crowns, extractions, and banded loops. They can actually size and fit these bands on the stainless steel crown on an extra one in the kit, and then just hand you it. You fit the loop, put it together, and glue it on. So easy, so efficient. Okay. And they actually hold quite well around those stainless steel crowns. That's a really common question we do get is, can you put it on a stainless steel crown? Definitely. Okay. We got one more question coming in, probably our last one to be able to take care. Sometimes the arm is just above the contact. Do you recommend using the band pusher to push it down, or does it risk destroying the arm? Or better just to cut it down? Great question. So if it looks like it's resting above the contact point, what I would do is consider using the curved, pointing it downward. So use the curved band, or if you've already made it and you can actually take a 3-prong plier and squeeze that loop and push it down more into the contact below it. So you can actually use a 3-prong plier to adjust it as well. Okay. Awesome, guys. Y'all have been such a great group this evening. I really appreciate y'all all taking the time to tune in. Awesome questions, awesome group, and hopefully y'all took a few great tips away.